Hi all, how are you? My name is Omar. I'm a third year respiratory student, and I'm here today for my presentation. And my presentation is about measurement of malignant perfusion using the indwelling catheter. And before I start, I wanna tell you why did I choose this topic for my presentation. Actually, I had a family experience with perfusion, but it was secondary to kidney failure. So my plan was to had the presentation about pleural effusion secondary to kidney failure, but it was hard to find resources for that topic, so I switched it to malignant pleural effusion using indwelling catheter after my first week in practicum. When I saw a patient with breast cancer was having the indwelling catheter inserted, and she came to the hospital with shortness of breath and respiratory distress. And once we got drained this fluid out, the patient was like able to go back to normal very quick, which was amazing to see that quick improvement of symptoms. So that's why I switched my topic to the indwelling catheter or management of the perfusion using the indwelling catheter. So in this presentation, I will be going first through introduction and purpose of the paper, then how the malignant pleural effusion is developed in first place in the pleural cavity, symptoms of those patients with malignant pleural effusion, diagnosis of malignant pleural effusion, management, which is 4 different procedures of management, and after that, the conclusion. So, and one, again, if you have any question during this presentation, please feel free to ask me at any time, and I will try my best to answer those questions. So first, let's start with the introduction. So what's malignant pleural effusion? Malignant pleural effusion is accumulation of exudate fluid in the pleural cavity, and it's very common among patients diagnosed with lung cancer and breast cancer. So when we talk numbers, we have 30% of patients diagnosed with lung cancer will develop malignant pleural effusion. Now, management of malignant pleural effusion include 4 different procedures. First one is video-assisted thoracoscopic surgery, pleurodasis, indwelling catheter, and chemotherapy. And in this presentation, I will be comparing between the 4 procedures of management, and at the end, I will tell you why indwelling catheter is the best choice because it's expensive and most effective and the one with least complications for the patient. So firstly, let's talk about the development of malignant pleural effusion and how the pleural effusion developed in the first place and get into the pleural cavity. So we have patient with lung cancer or breast cancer. So the tumor is growing, and those tumors, when they're growing, they're most likely will spread till they reach the pleural space and will result in increased fluid accumulation in the pleural cavity. And when those tumors start growing, we have cytokines, which is endothelial growth factor, will increase. And well, when the cytokine increase in number, this will increase the vascular endothelium permeability for the tissue and increase the fluid accumulation in the pleural space. And the growth of the tumor as well will inhibit the lymphatic drainage of the pleural fluid, decreasing the resorption of pleural cavity and increase fluid accumulation. Symptoms of malignant pleural effusion. Patient clinical history, especially in patients who have already been diagnosed with cancer, is very helpful for the medical doctor to confirm the diagnosis with malignant pleural effusion. It was surprising to know that 25% who are having cancer and already having pleural effusion will show no symptoms, and those patients will be and malignant pleural effusion in this patient will be discovered accidentally, especially during routine X-ray or any other routine test that was done by the doctor. So for the rest of the patient, those patients will have what we call classic symptoms for any patient with respiratory distress. So those symptoms are shortness of breath, chest pain, dry cough, and this dry cough is due to irritation of the airway, and generally, as the amount of fluid increase in the pleural space, the symptoms will be more noticeable. In some cases, as the tumor starts to invade chest cavity, thereby increasing fluid in the pleural space, the patient will begin to experience chest pain as the pressure increase on the chest bones, ribs, and sternum. So how malignant pleural effusion diagnosed? Chest X-ray is the first method or the first test being used by doctor therapists for diagnosis of malignant pleural effusion. Typically, anterior-posterior position will show fluid more than 200 ml in the pleural cavity and flattening of the hemidiaphragm, and this is when doctors start suspect and diagnose the pleural effusion. CT is more accurate than chest X-ray. The ultrasound can differentiate the pleural fluid from pleural tissue mass and provide an idea about the potential cause of pleural effusion, whether it's cancer, pulmonary embolism, or pneumonia. Fluid analysis of LDH to distinguish exudate fluid from transudate fluid. So the presence of cholesterol concentration, and this concentration should be more than 55 milligrams per dl, which is usually combined with LDH. And when the LH concentration is more than 200 international units per ml, the presence of an exudate fluid is confirmed. So this analysis for the fluid is done by chest puncture using a needle that inserted through the intercostal space and till it reaches the pleural cavity and get the sample. So there is a potential complication associated with this method, such as pneumothorax by mistake, and inflammation, infection around the insertion site, and moreover, there might be puncture for the artery or vein close to the rib where the insertion site is. So CT or ultrasound is more effective and more safe when used for diagnosis of malignant pleural effusion. Sorry. So right now we're talking about the management of malignant pleural effusion using the chemical pruridases. So chemical pruridases is the method when medical doctor drains the malignant pleural effusion using the type pluridase, which is pluridases procedure. During the procedure, the medical doctor will inject sclerosing agent into the pleural cavity in order to adhere the two pleurals. Complication associated with this procedure is pleuritis, pleural fibrosis, and effacement of pleural space as a result of chemical use. Inflammation of the tissue. The presence of inflammatory cells, especially neutrophils, increase the production of growth factor, which leads to stimulation of fibroblasts. Patient will be hospitalized for at least 4 days. Patient diagnosed with lung cancer and mesothelioma generally experience less benefits from the TALIQ procedure because of the side effects. Plus, this procedure is very uncomfortable for patient because the chemical or sclerosing agent used to adhere the two pleura in order to prevent future accumulation of the pleural fluid, which is very uncomfortable for patient to have no pleural space or have the two pleura adhered together. We are moving forward to another procedure, which is indwelling catheter, Indwelling catheter is an easy procedure for the management of malignant perfusion, and it's usually done on or used on outpatients because they allow the patient to control the drainage procedure at home. Catheter is inserted subsequently until it reaches the pleural space following insertion of 14 gauge needle through the intercostal space, usually between the 5th and 6th rib. Once the indwelling catheter inserted, it works as one-way valve, allowing only accumulated fluid and air to escape outside and prevent any other fluid, and even if fluid increased volume, it can't go back inside. Complication associated with this procedure, usually it's minor complications such as redness or inflammation around the site, which can be easily resolved using antibiotics, chest pain and discomfort, and once the catheter start working and drain the excess fluids, patient will feel comfortable right away. Malfunction of the catheter, and this is easy to resolve by catheter replacement. So here is a study that was done at University of Ottawa, and it was the comparison between the outcome or survival rate for long-term patient using indwelling catheter and taliprosadates. So we can see here over the time survival rate significantly increased with the indwelling catheter. And in the same study here, another study, or the same study here, was among 50 patients, or yeah, same research was done, different study among 50 patients, as for the complication when using indwelling catheter. So we can see here most of the complications are minor, and the number of patients experience complication are very, very low. So, and most of complications are resolved by replacement or antibiotics, or yeah, it's like minor stuff and can easily fixed. Okay, right now we're moving toward the third procedure, which is surgical management using video assist fluoroscopic procedure. And this procedure used to improve symptoms and has been shown to provide the highest survival rate among the different management options. But complication associated with this procedure, it is very expensive and not available all the time, and this procedure involves resection of pleura, partial and vesical, resection of the pericardium, and may include resection of parts of the diaphragm. The patient with malignant mesothelioma benefits from combination of more than one treatment, not only the surgery. We're moving now to the last one, which is the chemotherapy management, and this treatment method is done by causing contraction in the pleural space. The procedure usually done by administering cisplatin and distilled water into the pleural cavity using a chest tube. Complication for this procedure as well, you can see high cost, availability because it's not available in all sites and it's not available all the time, and using of immunosuppressive therapy for those patients. And this is a big risk for those patients because when you have immunosuppressive agent, there is more chances for infection and more complications. So conclusion. So pleural effusion are associated with lots of symptoms and complications for patients such as shortness of breath, chest pain, cough, and decreased lung volume in severe cases. This is why it's important for medical team, especially respiratory therapy, to take care of the management of malignant perfusion. Physicians, when they are going to decide which way they are using for management, they have to consider the exact diagnosis and therapeutic option for the patient as well as complication, disadvantages, and limitation associated with the chosen treatment plan. And because of those patients, like our cancer patient, and we need to keep them in the comfort level of treatment or management. So based on all the above factors, the indwelling catheter treatment is the most effective option for patient in terms of comfort, cost, complication, and overall outcome. And that was the end of my presentation. Please feel free to ask me any question if you have, and I will leave my email address here if you need any questions, like if you have any questions or any more information. I can provide you with all the reference I used and the research I used for this presentation. And thank you for your time, and all the best. Stay safe. Thank you.